So thank you very much for joining us on Zimai.com. You're from MESMAC,
Yeah.
this Yorkshire-based organization.
Mm-hmm.
Please tell me, in brief, your background.
Okay, my name is Aaron Chady. I'm a community development worker for Yorkshire MESMAC. Yorkshire MESMAC is an HIV prevention-based organisation in Yorkshire. We do HIV testing here, support for people around HIV, general help with other STIs that are associated with HIV too. So we work with communities who are at risk of HIV infection to keep them safe.
So are you going to demand for my real name? Because I've just come here to be tested.
If you come here to be tested,
ID?
we will never demand anything like that from you. We don't need ID, we don't need a real name, we don't even need a real date of birth.
What about my
or
fingerprint?
anything. No fingerprint at all, we'll never...
My DNA? Because you're going to take my blood, aren't you?
No touching your DNA. We need your blood to do the test because all tests that look for HIV lives in your blood, so we need to test it in some way or another. However, the test we do is like a pinprick of blood from one of your fingers. So a little prick on your finger and you drip a little bit of blood into a test. That's not done anywhere else, it's not taken anywhere else, it's done all in front of you. So you know that it's yours, you know it can't be tampered with, you can sit there and watch the test. It only takes 5 minutes to run before it gives a result. Other tests that people might do might be taking a little bit of blood from your arm, and with that blood that they'll take from your arm, they use it in the lab to check whether there's any HIV in that.
Now wait a minute, what if you are connected to the police and the Home Office? I know you're not wearing a uniform.
Not at all.
But
so we're a voluntary sector organisation.
so people would definitely like to know that.
Yeah, of course. So there's no connection to the police with us or the Home Office. We test anyone regardless of their immigration status. Because it is beneficial to everyone to be able to access free sexual health screening regardless of where they come from. Okay, so we will never pass on any such details to anyone like that. We don't have any connections to the police, and I think it's important for people to realise that in this country, in the UK, healthcare systems, there is a robust healthcare system in the NHS, and that is separate from police records, immigration, Home Office records. They don't automatically have access to those things, and especially here, the test that you would do here with us today at any community or based organisation is never going to go on your general medical record. Same as if you got any community based test done at a local gum service, that would never go on your medical records. Getting this test done with your GP, however, would likely go on your medical record. So there are alternatives that you can do, like coming to community-based organisations like Yorkshire MESMAC to get a test that is completely, confidential, separate from any medical record that you have. And like I said, you can give fake details. It's no problem for us. Sometimes you may need to remember the details you give if you're ever chasing up results, but that's not a problem in terms of your access to HIV tests.
But how long will it take till I get my results?
So these tests are a quick test, okay? We call it an instant results test. It's slightly less than instant. It takes about 5 minutes from the point at which of we starting the test with your blood to generate a result, okay? So that's quite fast. Some tests take maybe 20 minutes. It depends on what the testing platform is. The governance on those tests is different for everything. So, some tests, the rules are 5 minutes, some tests, the rules are slightly longer. If you can't do an instant results test, another really good test to do is a blood test from your arm, where they'll use a needle to take a little bit of blood out, and a lab will test that, and that's usually it varies depending on which lab in the country you might go to, but if you get it done at any gum service, it's usually between 5 and 10 working days for that one. There's a number of different testing opportunities. Ours is in minutes, yes.
And how much does it cost?
It's a free test. These tests are funded by public health. There's no need to pay for them. There's a lot of value in keeping them free at the point of access for people because it's in everyone's best interest to keep costs down for treatment. Get people to test so that they can make sure that they can stay safe in the future.
If I get tested and I find out that I'm somewhat positive, I'm going to live with this realization that my blood is not at its best. Obviously, it can improve medication. But in my head, have stored this new realm of fear, as it were. Don't you think that you are agents of fear yourselves?
Not at all. You know, I wouldn't ever use the term fear. I know a lot of people think of the word fear when they think of HIV, but actually you can live really, really normal life with HIV now. There's a lot of catching up that the stigma needs to do. People think of HIV and they think of, you know, that they will be cast out from society, that you cannot live a normal life, that you might be cursed. You know, all of these things, you know, have yet to catch up with the fact that actually plenty of people are living with HIV completely fine. You know, people get on the medication now, and the medication is really, really effective. Once you start on the medication, it's expected you'll get what we call an undetectable viral load within 3 to 6 months. That's a medical term, and it means that you've got so little HIV in your body that you can't pass it on to other people. That is achievable by about 95% of people living with HIV. Okay, so the reality is that actually there's very little chance of passing it on once you've got on the medication. Okay, but the stigma hasn't caught up to these facts yet. Actually, you know, we don't seem to understand that. You know, it's only in recent years that we've really come to understand how effective the medication is. That actually the chances of you transmitting it onwards are effectively zero. Most people get HIV from someone who's recently caught it and is not on the treatment. And when you're recently infected, you're very infectious. Before you start on any of the treatment, you're likely to pass it on to other people. So once people start on the treatment, there's effectively a way of controlling the spread of HIV onto other people. So, you know, people have this fear, people worry about getting tested because of all of these things, but actually testing is good either way, because it's there in you, whether you know about it or not. If you get tested, you know, if it's negative, you can know that actually you've been keeping yourself safe, and you know about how to continue, you know, keeping yourself protected in the future. If it's positive, you can get on the medication and your outcomes are much better. You know, we all know what happens if you don't take the medication. Your health outcomes are much worse, and it can, you know, be fatal to not take your medication.
If I find my partner is HIV positive and we've been together and I'm not, what should I do? What should I do? Because that's another dimension. That, I mean, it's one thing for me to find out that I am HIV positive or positive for any of the other STIs, chlamydia and all sorts. Now I discover that my partner is positive.
Well, you see, for me, you know, we just need to look at cases like this to understand that actually people can live really normal lives with HIV and be very unlikely to pass it on. Here we have a case where someone's been, you know, someone's partner's been living with it for 4 years and not passed it on to them. You know, that's a testament to how effective the medication is. There's your evidence that it really does work as well as people say it does. You know, I think a lot of people really struggle to believe that actually someone with HIV cannot be at risk of, you know, passing it on. But actually it's science, you know, it's how effective the medication is. If you find out your partner has it and they've got an undetectable viral load, you can know that you're very, very unlikely to get it from them. You know, it's probably the safest person to be with, because if you're with a partner who doesn't have HIV and then they go and catch it, the chances of them passing it on to you is much higher, you know, because they won't be on the medication. But the people who are on the medication, the chances are much, much lower for them to pass it on. You know, it's effectively, we know that it's unheard of for it to happen when people have that undetectable viral load. The science is really, really strong on this one. So, you know, I would say it doesn't change anything about the person you are with. If you find out your partner has HIV, they're still your partner. They're not a disease, they're not a label, they're not a status. They are a person. And you know that, you know, you've been with them this entire time. It changes nothing. But for, you know, if HIV is something new to come out in your relationship or another STI, what you need to do is communicate. And as a common sense thing, you need to get tested as well. You know, the only way to really know whether your prevention methods are working as well as you hope is by getting tested. And, you know, there are so many ways in which you can do that for free, confidentially. It's never going to get back to anyone else. You know, and it makes sense, you know, in terms of keeping you safe, keeping everyone else safe. It's the most sensible thing to do.
So where should I go for these tests in the UK? Because mean, I know here we're in West Yorkshire.
Mm-hmm.
You offer this service, okay, covering this whole area
Mm-hmm.
and people around this area. If I'm in London, if I'm in Leicester, if I'm in Birmingham, where exactly can I go to get these tests?
Mm-hmm. So, I mean, we are based in Yorkshire, as you said, Yorkshire Mesmac. We are a community-based organisation, but we're not the only one. You know, around in other different areas of the country, there will be other community-based organisations offering these instant results tests. And, you know, they'll be offering them, a lot of them will be funded to offer them, so you don't need to pay for them. You know, I would really not advise anyone to ever pay for an HIV test when there are perfectly good free HIV testing services around. You can go to any local GUM service and get a test there. Usually they'll offer blood tests and point of care tests. They're by far the most common ones, often NHS funded but not always. And they'll offer you free HIV testing. If you can find a community-based organisation in London, there will be lots of them. You know, in other areas as well. You know, big towns is likely to at least be an HIV prevention organisation there, or somewhere you can get tested. It's something that you will easily be able to find on Google or by looking on services such as the National AIDS Map. You know, to just kind of find out what the services are there for people. But you know, there are a lot between the GUM services, between community-based organisations offering extra. There will be something out there. And for people who like to go out of area, there's no reason why you can't travel to do an HIV test and do it away from your local area if you feel more comfortable, you know, doing it away from seeing people who in the community who you might not want to see.
So thank you so much, and we really appreciate your
Very
contribution,
welcome.
and we hope our viewers, readers and listeners out there, we're hearing it. We've been told here nine areas of concern in our community about HIV, and I hope we have learned one or two things. And just to recap here, my questions were in the area of confidentiality. If I come to Yorkshire Mesmac, for instance, or any one of these other organizations, do I have to bring in my passport or my ID or my driver's license? Will my fingerprint be taken? And not at all. None of that. Okay, will my DNA be taken? Because they're taking my blood, so maybe they might be taking a sample of my DNA. None of that. They're just using it for the test, and that's it. And are they connected to the police? No, not at all. And how much does it cost? Absolutely free. And it appears that, like we have in Zimbabwe, we have got the New Start centers. In the United Kingdom, they also have this combination and a group of organizations that are scattered around the country serving in the area of HIV testing. So if you ever do need a service, if you ever do need to be tested, do not worry. You don't need to disclose who you are. Just rush to the best. Google is your...
Google will help you. There are national organisations such as the National Sexual Health Helpline, which you can call for free as well. The number for that is 0300 123 7123, I think. And if it's not, you can correct that one on Google. But that's an organisation that you can use to call up if you've got any questions about sexual health in general or HIV in general. And that's, I know, not the only line that exists out there. There are many other places that you can go if you're asking questions, but I think it's always better to talk to a healthcare professional either in the community or within a local GUM setting if you've got any questions.
Oh, splendid. Thank you very much. Now for my test. Thank you.
Okay, let's do it.